We are in studio live at the iHeartMedia Studios in Hartford, Connecticut, and we have the lovely Dr. Tara who made the trip from Jersey to be with us. So welcome back to iHeart, Tara.
Thank you. I love being here.
I know.
I think I'm an honorary New Englander.
I think so.
Jersey girl turned New Englander.
And I'm New England or Jersey girl, but we both have spent a lot of time in each other's states. So.
Yes.
But yeah, we are in the midst of season 3. So this is very exciting that we have 2 special guests with us today. And we're going to be talking a lot about chiropractic care, neurology, the correlations. I mean, I am a frequent chiropractic care patient, as are you.
Yes. I got my adjustment before I got into the car yesterday to drive to Connecticut.
Oh, see. So actually, one of the people here is my chiropractor, which is very fortunate. And I really have been stressing him out because I fell off the stage. I got in a car accident. I bruised my tailbone. It's like one disaster after another. I text him. I'm like, Dr. Phil, you wouldn't believe what happened now. But I have to say that chiropractic care throughout my life has really, really helped. I have long-term back spondylolisthesis and cheerleading and gymnastics and all that stuff. So we're really excited to dive into all of the details and kind of talk about all these correlations.
Yes. And chiropractic, like I told you, has been a huge part of my life since I was about 15 or 16 years old, all due to a car accident. It was a 5-car pileup and I had whiplash and herniated discs. And so it's really helped me.
In my hometown, shout out to Cromwell.
But wait a minute. Both of our guests are originally from New Jersey.
Oh, so, yeah.
Born and raised.
Yes, and from my neck of the woods in both spots. So that's great. Welcome.
Thank you. Yes.
All right, so tell us, we'll start with Dr. Phil. Tell us who you are and a little bit about what you do.
Yeah, my name's Dr. Phil. I've been a chiropractor since May 2022. Before that, my history includes an EMT throughout my high school years. In undergrad, I studied health sciences, pursued massage therapy license after that, worked for chiropractors as a massage therapist, got involved with CrossFit. I still currently coach CrossFit 13 years later. And then I had a job in medical device sales in 2015. I became a shoulder specialist, worked the OR, assisted in probably about 1,000 surgeries. And then from there, I became a chiropractor, and it's been great ever since.
We love that. We meet a lot of people on our podcast, myself included, and Gina included, that have really evolved and had different careers that led them to where they are today. So that's a beautiful journey.
Yeah, thank you. Learned a lot on the way.
I bet. And you, sir?
Dr. Weiss.
Well, I graduated from Ruggiero, and after that, I worked for an ear, nose, and throat doctor for 3 years, managing his allergy department. Then moved to Long Island, where I worked 5 years for a holistic MD, where I saw some amazing things. And then decided I was on my way to getting a master's in nutrition, and just stumbled upon going to a chiropractor, and it just did amazing things for me. And I said, okay, what's a chiropractor? And went to chiropractic school. Then after that, bounced around, worked for a couple of different practices, probably for the next 30 some years. And at the ripe age of 70, decided to open up a new practice with Dr. Phil. And I made
Wow.
Wait, really?
that he couldn't refuse.
I love this. Oh my God.
It's fantastic.
And I got into the whole neurology program. Oh gosh, my practice in Wallingford. I had this young woman. She was 26, registered nurse, at a pulse rate of 200, and went to the cardiologist, and cardiologist couldn't figure out what was going on. Someone says, oh, go see this chiropractor. I didn't know what I was doing. So I worked with her a couple of times. Nothing worked. I says, let me try one more thing. Adjusted her one side, one spot in the neck. She comes back the next day, says, I'm cured.
Wow.
And since then, she has 3 kids and never had a problem ever since. And I thought, what did I do? I couldn't explain it. And I thought, if I can take it away, I can create it. So I have to understand what I was doing. And that started me on neurology.
So interesting. And I love that you bring it up, because obviously we're big fans of chiropractic care, but as a healthcare professional, I know a lot of times medical professionals do not see the benefit. They don't give chiropractic care credence. So I'd love to hear more about this intersection of neurology and chiropractic.
Well, it's interesting because my wife's a primary care doctor.
Okay.
And
you have to speak closer.
And most of my friends my intimate friends are all primary care doctors. And we just get a ton of referrals from the primary care doctors, from people like Amanda Swan, neurosurgeons. We see ophthalmologists, optometrists, naturopaths. So we basically go and tell them, send us your failures. And
Wow.
don't send us your successes. I want to see the people that you cannot get better. And that's the people that come to see us.
Wow. I think my aunt goes
And
to
it's
see
amazing. Yeah. But it's amazing how many physicians that we take care of.
I
Yeah,
love to hear that.
We had saw someone, he was a primary care doctor, he had a stroke, and what was the first thing he did? He came to see me. And I just gave him certain eye exercises to do. And before that, he couldn't drive, he had double vision, he couldn't practice. And we got him in a certain set of glasses, gave him certain eye exercises to do, and now he's 100%.
Wow.
So we see things like this all the time. And it's like, oh yeah, just another person. We had 2 people with strokes yesterday. Just giving them things to do. One, he's almost 100%. So, we see this a lot.
And there's a lot of myths, like Tara was just saying, like misconception. Dr. Phil, what are your most common myths with chiropractic care that people bring to you and say that it's, it doesn't work, it's just a thing, it's placebo effect? Like, what are you seeing?
I see a lot of questions about, once I start, do I have to continue? The answer is no. A lot of people out there believe once you get adjusted, you need to continue that. That's not always the case. Depends your goals and what your outcomes are for yourself, all part of your wellness journey. First and foremost, we want to help resolve your chief complaint that you're presenting for, whether it's numbness, tingling, weakness, pain, dizziness, headaches. Resolve that first, and then determine your course of care if you do want to pursue the maintenance care. That is something that's popular in the field, involves once a month adjusting to make sure you are keeping your symptoms at bay, and we have an idea of how you're progressing with your own care as well. That's a big thing that we usually have to face.
Yeah, I would say, I've been seeing you for probably a year, 2 years, and I've gone to a million chiropractors, and I was on a schedule. Like, they're like, you have to come in 3 times a week, and we're going to do this, and we're going to do that. So when you were like, okay, I'm like, when do I come next? You're like, well, whenever you're feeling, and I was like, wait, what? So it's a different approach. And I have to say it's working because it's like you do this hands-on approach. And talk to us about hands-on versus like the gun versus, all the different methods that chiropractors use.
Right. Being manual therapists, our job primarily is hands-on. The gun that you're talking about sounds like the activator. That's another way to apply an adjustment with less force. That's something I don't use. I prefer to feel with my hands, palpate with my hands to get true information off the patient. The hands-on care comes from doing manual massage work on the body. We have vibration device that we use to massage the muscles of your back, as well as applying the adjustment is a hands-on maneuver. And that's the best way for me to get feedback about your body as well. It lets me learn more about you passively outside of what you are telling me.
Interesting.
When do you think someone should see a chiropractor? Because I think people revert to it, at least in my sphere, if they've been in a car accident or if they're having chronic back pain or neck pain. But it's not only that.
It's not only that. It's up to you when you want to decide chiropractic care, but we have seen people get relief for all sorts of things that aren't explainable. Yes, we are perceived to be pain doctors, but after learning from Dr. Weiss, we can do much more than just pain. We can improve quality of life, improve function of your body, whether you feel inflamed, chronic fatigue. There's many different avenues you could pursue. So typically the first point of entry would be pain management. And then after that, we start to educate about how chiropractic care could help somebody long term.
I've referred people who are depressed, and I've referred women who are having infertility issues just to make sure. I just feel like if your spinal cord is the focal point of your body, that's innervates your entire system, all the systems in your body, that if they're misaligned, that something's not going to be functioning properly. So what are your thoughts about that?
Yeah, well, everything is to how can we activate the brain?
Okay.
So the sensory system accounts for about 70% of stimulation into the brain. That's where chiropractic comes into play. Exercise, massage. Like, why do you feel better when you exercise?
Yeah.
Mm-hmm.
Why? How come?
Because you're endorphins.
But no, because you're activating the brain.
Oh, yeah, that's it.
And then the brain then goes and dumps the endorphins into the spinal cord and does a whole bunch of other stuff. Well, that's only 70%. What about the other 20% or 30%? So 20% is the vestibular system and 10% is the visual system. Doctors, PTs, manual therapists, so on and so forth, just deal with the sensory system. From a neurological aspect, we deal with the visual system, the vestibular system, inner ear, and the spine. And he says, okay, well, what is the engine for the brain? What drives the brain? And that's really your cerebellum. And what drives the cerebellum? Your spine. So the spine is really the solar panels that drives the brain from an electrical aspect. And if the spine, as you said, is misaligned, I don't like saying that, it doesn't mechanically work correct. And if the joints work mechanically correct, then it can appropriately stimulate the cerebellum and the vestibular system, which then goes and drives the entire cortex. Whether or not that's involved with, well, depending upon which area of the brain gets affected, will then dictate your symptoms. Whether or not it's involved with the brainstem, which can affect the visual system, it affects dopamine into the brain. So it's interesting, you take a cross-section of the top portion of the brainstem, the area that moves your eyes sits right next to the area that supplies dopamine into your brain, which then sits right next to the area that drives the whole autonomics. And you go, okay, so if the eye movements are working correctly, then you can get appropriate dopamine stimulation into the brain, which is what makes us feel good. Or if there's too much dopamine, you get real aggressive. If people become socially inappropriate, this is, oh, I'm just going to go shoot up a school today. These are crazy people. So that's what happens. The sensory systems are not working correctly. And what drives that? Your neck and your back. And what's the greatest input into all that? Your neck.
I have neck problems like crazy. And it's like, and I mean, I love what you're saying. And talk to us about like the holistic part of it, like dietary factors and how all of this, your brain fog and all of these things play into the neurological care and the chiropractic care.
So if people come in with brain fog, it's usually coming from one of two things. Either one, from lack of stimulation, because the brain's not getting adequately activated, or two, it's an inflammatory process. It says, okay, if it's an inflammatory process, what is it? A lot of times it's a gluten and dairy sensitivity. So we have to be very mindful of that. Could a mold toxicity cause something like this? Absolutely. Could a Lyme disease problem cause this? Yes. Could COVID? Absolutely, 100%. So we have to differentiate which one of these things happens to be affecting these people, especially with a brain fog type of problem.
So, Dr. Phil, then could chiropractic care improve things like memory or recall?
I believe it can. If you feel your best, you're going to perform your best. And that means you're going to be more present in your current situation because your focus is on what you're doing and not the pain in your body or the restrictions you feel.
Can we work on that like next time I come in? Can we work on that next time I come in? Because I have a lot of brain and memory problems. I think let's do a focus on that. Yeah, I can't even remember why I'm here.
And that's one of the things that we offer is that we have the thing called the Cambridge Brain Science, where it was designed by this guy Adrian Owen, who was a PhD out of Cambridge, England, who worked on people who were clinically brain dead. And he figured out a way how to communicate with them using functional MRIs. And he wrote a book about it, Into the Gray Zone. And from there, he then designed the series of 12 tests that we have people take at home. And from there, we can identify which areas of the brain happen to be deficient. So that this way that we can then give you specific exercises to activate those particular areas of the brain that are weaker compared to something else that's stronger. So people say, well, I do all these brain exercises. Yeah, but what happens if you're just doing those exercises to a strong area of the brain and you're neglecting the weaker area? So with the Cambridge Brain Science, it just gives us a physical score, a number, and this way we know exactly which areas of the brain to go after, and then we give people a whole list of simple brain exercises to do. That's very simple, very easy, but it targets those areas that are weaker compared to others. So that's one of the ways that we help with people with brain fog and memory issues.
I love that. I just heard a study about B3 vitamins and green tea. If you take them together, it helps prevent Alzheimer's and your brain function. Have you heard that? Is it all just, it's like sensationalism? I mean, just if you're listening, Dr. Weiss's face is just like, come on.
It's gimmickry.
Okay.
You look at all the advertisements on TV. They says,
Amazon, cancel my order.
This thing for brains, and you look at it, it's like they're just one or two compounds in there. It's just they're so gimmicky. They're really just making money on people and not really understanding what they're doing to improve people's cognitive function from a nutritional aspect.
Right. So what do you think helps nutritionally to improve brain function and prevent memory loss and dementia. Is there anything that we can do, dietary or health-wise?
Oh, 100%. Absolutely, without a doubt.
Okay, I'm writing it down. Give me the recipe.
Are you guys recording this?
Yeah, there's a great book out there called End of Alzheimer's by this guy, Dale Bredesen.
Oh,
He's an MD out of California and wrote a phenomenal book about Alzheimer's, about what you need to do step by step. You got to watch out for the sugar contents because that'll kill you.
Tara's really writing this down.
Yeah.
By the way.
You want to go gluten and dairy free.
okay.
Complex exercises.
No.
Not like riding a bike or walking, which is nice, but going out and playing pickleball, go dancing, moving around.
Okay.
Tai Chi.
Yeah.
Yeah.
But you want to do complex movements. And then after that, you want to do fish oils, vitamin D, and magnesium threonate. Then that's the first tier. Then the second tier is you get into antioxidants. And there's a whole ton of antioxidants, B complexes. So when you see these advertisements on TV, they just pick one thing for glutathione and magnesium.
Yes.
Well, that's just part of the story. That's not the whole thing. That's not the whole package. And to do Alzheimer's, you need to do the whole thing. Alzheimer's is very personal to me because my best man, who I grew up with, was brilliant. I mean, he's now in a psychiatric facility because he's got terrible Alzheimer's. So, so when we see stuff like this is real. So, but you have to start with the Alzheimer's prevention 20 years before it happens. But that's where all the vitamin comes into play, the fish oils. And it all has to be quality stuff. You just can't buy something off the shelf and says, oh, I take this. Well, what happens if it's garbage?
I was taking CVS and Dr. Swan was like, absolutely not. She's like, no more. You have to go through these.
That's exactly correct.
Yeah.
Get what you pay for.
Yeah.
That's right.
Supplement like glucosamines. I've only found one, maybe two companies of glucosamine that helps with joint repairs. That really works. But everybody and their uncles got, oh, we got glucosamine here, glucosamine there. But it doesn't work.
Yeah.
Right.
Or that the results are just minimal and they're not that effective. So the quality of the supplements is paramount.
Sure. Yeah. My primary care physician, I'm not promoting them, but a website that does research. You can call them on the phone. Everything's very clean but it is costly. And Gina knows I take a ton of supplements.
She takes about 42 a day.
No,
I'm not. Well, all right.
Look
sorry,
at
32.
Dr. Phil's face.
He's like, oh my
So
God.
that's a meal.
Yeah. Well, so kind of talking about like the vitamins and staying healthy, obviously, working out, and you were saying, moving your body. Dr. Phil, you were a CrossFit coach. So how do you see the correlation between weight training and neurological health and chiropractic health?
It's important to stay strong. The more you use your body, the more you'll benefit from it. You want to keep your systems fired up. The body acts as a pump. The body wants to go to work. So if I fuel my body with what it wants to do, it's going to provide me with the benefits of feeding my body, so to say. I feel great after I work out. I feel as if I did that activity for myself. Plus, I feel the benefits that I get from the strength training and the cardio. I feel like starting my day with a workout gets my brain ready to go. My body feels great, clearer thinking when I'm at work, and I just feel overall more present than when I were to not work out, say on a rest day.
Strong body, strong mind.
Strong body, strong mind.
And Gina and I did not work out this morning.
No, we did not work out this morning. I had a little bit of a late night. Yeah. Well, I know my gym was like, oh, you want to come at 5:30 this morning? I'm like, nope. But it's super important. I mean, I feel like you have a very well-rounded, with the massage therapy, the chiropractic, and the strength training, to tie all that together. And then, so tell us how your practice kind of marries the neurological with the chiropractor. Like if a patient were to come in, what does that look like?
The priority that I like to use is brain comes first.
Okay.
You got to fix the brain because the brain controls muscle tone. And people says, oh, I got all these tight muscles and so on and so forth. Well, yeah, try stretching a person who had a stroke. Try stretching a person's Parkinson's or MS. It doesn't work. Because why? Because their brain can't inhibit the muscles inside their system. So you got to fix the brain first. Next priority is make sure all the joints are working correctly, especially in the neck. So this way you get proper afferentation and stimulation into the brain. Then simultaneously we'll work on the muscles. And that's where if the joint can't move, the muscle's going to atrophy. And you'll lose 50% of your muscle in 7 to 10 days. And the body says, oh, geez, this is no good. So what does it do? It puts concrete in there, which is collagen scar tissue. And that's all the tight spots that you feel in deep massage. So first we fix the brain, make sure the joints are working mechanically correct. Then we go after all the adhesions, myofascial stuff. This is where massage comes into play. We like to give people the massage stuff that they can do for themselves at home, because I'm very particular on to which muscles they do it and how do they do it. Then you do the strengthening stuff. But if you try doing the strengthening stuff if the brain isn't working well, the joints aren't mobile, mechanically mobile, and you got tight muscles in there, come back in 20 years. You know what? Nothing's going to change.
Interesting.
Wow.
And that approach works.
You know, something else funny that actually Dr. Phil had me do after I fell off the stage. I was like, he was trying to get me to be like stronger, like pushing down. He's like, just go home and hold something that vibrates. What did you say, for like 30 seconds?
15 seconds on 2 sets.
Yeah, and just hold it. First of all, I'm like, what do I have that vibrates? And then I'm like, oh.
Gina.
He's talking about relationship.
Yes, I'm talking about my Theragun. But anyway, so I just think that's so fascinating. Like, how does that work?
Dr. Weiss, that's more up your alley. He's the one who's training me the ins and outs on that.
So when you look at the sensors inside the body, we have all these different types of sensors in the skin. One is for light touch. Another was for crude touch. One is the muscle contracted? Is the muscle moving? What's the position of the joint? Is the joint moving? Is it not moving? How quick is it moving? So it has all these different receptors, and each one has a separate pathway. Vibration hits everything. That's why we love vibration, because it hits every single one of those receptors, as opposed to, if you just do a massage, you're just going to hit the muscle spindles. If you do manipulation, you're going to hit the muscles and you're going to hit some of the joints. But if you do the vibration, it hits the skin, the joints, and the muscle, and it just completely activates the whole brain. Now, we've had times when people's brains were so fragile, and this just happened last week. This woman, she got hit with lightning twice.
Oh my God.
And
Wow.
And as soon as she can't even hold an electric toothbrush, and it'll put her into all these tonic muscle, whole body contractions, because the vibration is just too powerful for her.
Wow.
So vibration is a magnificent tool to activate the brain. But the question is, what side you do it on? This is where it starts to get interesting, because if you do things on the wrong side, it can make you worse.
So my dad had a stroke, a severe stroke. Do you recommend him holding anything that vibrates? Would that help, or?
It depends. It completely 100% depends upon the individual. And that's our job in the whole neurology field, is to figure out, okay, what works for one person will not work for someone else.
Love that.
Like that one person.
It's just a guessing game.
No, but we have, it's evidence-based.
Yeah.
And this is all based in research. And we've had 3 times, I've had different neurologists say, it's chiropractic voodoo. No, it's not. It's science. It's medicine. When you understand the anatomy of the brain and how the brainstem works, you can understand how to tap into it. So what works for one person does not work for somebody else. So we had someone else who had a stroke, and I gave him nothing but visual exercises to do. He came back 100%. We had someone in yesterday who had a stroke, and he's like 95% better. And I have him doing more mechanical, physical movement activities and certain eye movement exercises at a certain rate, at a certain direction, at a certain speed. So everybody is completely individual, and what works for one does not work for everybody. And we see this over and over and over again, where people have gone to all these, stroke facilities and vestibular rehab and all that type of stuff, and we get them 4 or 5 years later because they're doing it in the wrong direction, and they're screwing the people up, and they're making them worse.
I love that philosophy, and I subscribe to that, because what works for one does not work for another. And I think that in many disciplines, there's a standard or a template almost, that if they have this, give this or do this, but it's not the same.
It doesn't work.
No.
It doesn't work. And that's where our practice is based upon brain-based adjusting. So when people come in, do we adjust every single spot that's around? No. I had migraines for umpteen years. Every chiropractor I went to created a migraine on me the next day. I'd be sitting around losing vision and puking over the toilet bowl. Until finally we went to one of our neurology classes. They started introducing concepts of left versus right side brain. And then we just started doing one spot on me. And my migraines have been absolutely magnificent since then. We do the wrong side, and it could trigger 4 migraines in 10 days. And that's happened.
So for someone that has current or often migraines, gets them a lot, this chiropractic care, neurology care would be advisable for them?
Right. But you see, with migraines, there's 4 things you got to deal with. Number 1 is the brain-based activities, because then that affects the sympathetics and the parasympathetic systems. That's utmost paramount. 2, it could be simple mechanical. Oh, geez, I got a tight spot in my neck. It could be dietary. Geez, I'm anemic. I got blood sugar issues. I eat too much sugar. I have chocolate. It could be hormonal.
Right.
And when it's hormonal, that's when we send people to Amanda Swan.
There you go. We love Dr. Swan.
So your practice is based in Connecticut. So we have listeners in many, many, many different countries.
47 to be exact.
47 and across the country. So what would you tell a listener that is eager to try this, but they don't know where to begin? How can they find someone?
There's it's the American
Sorry.
Board of Chiropractic Neurology.
ABCN. There's a website you could search for a provider with those specific credentials.
Yeah, the problem is that there's so few of us. I mean, there's really two of us are board certified in brain injury, myself and some other person. There's maybe 10 chiropractors in Connecticut that are neurologically trained, soon to be 11.
Wow. All right, Dr. Phil.
There's some places where people says, oh, well, geez, I need someone in Florida. And you look around, it's like, there's nobody within 50 miles of you.
Wow.
I mean, there's some states where there's not one. So there's just so few of us around. So it's hard to find someone that has the training that we have.
We'll have people travel to see Dr. Weiss from Florida, North Carolina, places out west, come in for once a year for a visit, just to check in.
Yeah, last night had someone come in from Massachusetts, and a couple of days before from Rhode Island.
So you cover people from all states. So if they wanted to travel to see you, you could see them. That's good.
As long as you're in Connecticut.
Right.
They can be from anywhere.
Got it.
Yeah.
Yes.
So, Dr. Phil, we know that you are very much passionate about CrossFit, and obviously you are fit. So
Thank you.
You're taking care of yourself.
As he's sitting there flexing.
But collectively, what do you two do for your own wellness and health and optimizing that?
Well, I have Friday night fires.
What does that mean?
That means I have a little fire pit in the backyard.
Oh, yes.
It's like little fires everywhere. Like, what are we talking about here?
I have heard of that. Come to think of it,
And I sit back there and I just look at the stars and give yourself time to think and to be quiet.
I love that.
That is great. Friday night fires.
I do that almost every Friday night.
And fire is great for meditation. Even if you light a candle and do breathing and stare at the flame, it's very good for just your nervous system and getting centered.
It is.
And it's primal, right? Our human ancestors started around that. They sat around fires.
Yeah. It's interesting. They looked at some very, very successful people, Steve Jobs, Bill Gates, a couple of other people. And what do? There are times when they would just go isolate themselves for several days and just think. And that's what I do in my Friday night fires. Wow. And then when you come to these understanding, these realizations that, oh, geez, I have to do this, or this is the right way to go. And you make the decisions based upon that, but you clear your mind and let things come to you.
Very cool.
It's definitely one we haven't heard before.
It's Friday. We need to.
Well, we're going to the casino, girls, so we could say. We can clear our minds at the blackjack table. Yeah.
And what about you, Dr. Phil? Anything besides your physical fitness that you do for wellness?
That's kind of my life. I'm a big body in motion kind of guy. I believe in well-rounded diet, appropriate rest, spending time alone, isolation. I love to just be active. So for me, that is my way of self-care. If I'm having an active rest day, I think being quiet and just organizing the matters in my own life that I need to get done, silly little errands or catching up on paperwork, just enjoying my downtime and being grateful that I have the ability to be as aggressive with my body as I can be.
And then we also ask $1 million question to all of our guests on our show is, what does Welloff mean to you? And Dr. Weiss, we'll start with you.
Have a healthy brain, have a healthy body. So this way that I'm not hindered by any type of restrictions from a cognitive aspect and from a physical aspect. Looking at myself at the end of the day, saying I did everything I possibly can to help somebody else in some way, shape, and or form, make them better in some different ways. And my last one is to share my knowledge with the neurology to as many people as I possibly can. And that's why Dr. Phil is here, because he's going to be my successor. And I want him to be better than me. That's my goal.
It is so powerful.
I love that. Yeah. No, that's great.
I have the chills.
I know.
We get the best answers. We really do. And what about you, Dr. Phil?
I believe I'm living that right now. My goal is to be able to pursue all activities without restrictions, full capability, carry out my daily duties without any restrictions, just pursuing what I want to do on the day-to-day without any reconsiderations or structuring of what I have to do.
It's funny. Last night before I drove up to Connecticut, I attended a gala event in New Jersey, and I was sitting with lovely table mates, and they were like, well, why are you leaving? And I said, well, I have to go to Connecticut. And I told them about the podcast and the name. And right away they said, oh, are you going to teach me how to be rich? And I said, interestingly, we ask every guest what Welloff means to them. And it's never about money. And we love that.
Yeah.
And health is wealth. And it's so true. You know, to truly be wealthy is to be fully functional in every aspect. So thank you for reinforcing that.
I always tell people everybody can get hemorrhoids.
Well, that took a turn.
Theoretically.
You could be the president of the United States. Happened with Jimmy Carter.
Jimmy Carter got hemorrhoids?
Yeah, they had to go and have surgery, so he was out.
Of course.
And it happened with a baseball player who was at the top of his game, was probably the best player in the league at that point in time. And they were going into the playoffs, and he couldn't play because he had hemorrhoids.
Wow.
Oh, who was it? Who was it?
I'll tell you later.
Is he here right now?
I was going to say, is it Rob Dibble? Because he's in the studio next door. No, I'm just kidding.
No. So you can be the most powerful person in the world or be the greatest athlete at the same time, so you can all have hemorrhoids. So that levels the playing field.
Mm-hmm.
So that's why I treat everybody the same.
That's right.
And no matter how much money you have, you can still have hemorrhoids.
What's his name? Bezos still gets hemorrhoids.
That's no. Yeah, we're all the same. I think is what you meant.
So say we all put our pants on one leg at a time.
That's right. That's right.
Yeah.
Well, I know I have learned a lot today, and I will be buying that book, even though you didn't write one. You have to write one, Dr. Weiss.
I'm actually in the process.
Okay.
Oh, good.
Because, you know, I'm really baffled just by, I feel like so many aging adults have dementia or Alzheimer's or some cognitive impairment, and it's frightening.
It is.
And I don't want to be that person. So I am gluten-free, dairy-free, except for a little cheese here and there. But I know every once in a while, but really try to take care of myself and body and brain. So I am really going to take what you said to heart today.
Yeah, there's a couple, and we have in our waiting room a couple of books that are just absolutely phenomenal books that can really change your way of thinking.
Tell us some more.
Another one is excitotoxins. What's his name? I forgot what his name is. It could be Dale. I think it's Dale Alexander. And he's a neurosurgeon. He wrote the book 25 years ago describing what causes Alzheimer's and Parkinson's and ALS. And he all brings it back down to our foods. And it's interesting because what this guy in the book Excitotoxins talks about, the guy from the Bredesen who talks about Alzheimer's, says exactly the same thing. And all of our classes and courses in brain chemistry and all that stuff, they're all saying exactly the same thing. But, you know, and MSG is killing us. And there's another one. Yeah. Perfect Poison is another great book to start with about MSG and about what that does to people. So we have people start with Perfect Poison, then they go into excitotoxins, and then read the book with Bredesen on the end of Alzheimer's. And they all make sense.
Wow.
Alzheimer's runs in my family, so it's hereditary, isn't it?
Only to a certain extent.
Really?
But a lot of it is environmental. And what these guys did in that book, Excitotoxins and the End of Alzheimer's, they actually break it down to how these chemicals in our food affect certain neurotransmitters in our brain, and then that's what damages the brain.
Oh, that makes sense.
It makes a ton of sense.
Yes.
And then one of the things that blocks that is magnesium threonate and fish oils and antioxidants.
Alexa.
Magnesium citrate, magnesium threonate.
Threonate is the most effective form of magnesium to get into your brain.
Okay.
If you go get a colonoscopy, they give you citrate because that just cleans your gut out.
Yes.
So it says, I take all this magnesium citrate. Well, that's not getting into your brain.
No. I always recommend magnesium glycinate.
Glycinate is, they're okay, but the threonate is the king if you want to get it into your brain.
Okay.
Does that help with sleep too?
I'm adding that to my
does.
regimen.
Not going out all night helps you sleep.
All right, Phil.
Dr. Phil, you're sounding like the fun police.
He's not the fun police.
Oh, this has been really delightful. And our whole mindset is if one person listens and is helped or changed in any way, then we've done our job. And I know that that's happened here today for a fact.
I agree.
So thank you.
Yeah, thank you for sharing all of this. This has been so helpful.
And how are people going to find you?
Different avenues. chirocct.com.
Okay.
Or a quick Google search will bring up our office location right in Cromwell.
Excellent.
Do you have social media?
We do.
I don't-
Dr. is like,
Dr. Weiss is famous on TikTok. Feeling no?
No.
He's like, no.
Well, we have.
Okay,
It's Weiss_Ruggiero CNC.
okay. You heard it here.
I go by word of mouth.
Yeah.
Wow.
We haven't done any advertising, and from the first day that we opened up the practice to today, I really have absolutely no appointments open.
Wow.
Wow.
But it's all by word of mouth.
Sure.
You do the right thing, and people, one person
Word
tells
gets
someone else,
around.
gets words around and says, I'm not even done with an examination. He goes, oh, can I bring my husband in? Can I bring my kids in? Because I have this going on. And before you know, it's like, oh my goodness, I haven't even worked on it yet.
Right, right.
Well, I have to say, it works. What you guys are doing is working.
Yes.
I mean, I fell off the stage and I was healed in a week.
And then the car accident.
But, I just feel like, all of the things. So thank you again so much for coming in.
Thank you so much.